If your implant plan involves placing more implants, the rules of thumb for placement remain the same. However, if you wish to make those implants parallel, you have the option of going to Add Single Implant and selecting the box that says Make All Implants Parallel for either the mandible or the maxilla. All implants in the plan will become parallel to the first you adjust after selecting that option. Generally, it is best to have implants parallel when case planning for a bridge or the anterior implants for an all-on-4 because they provide more stability. If you wish to only have some implants parallel, place the parallel implants first, parallel them using the Make All Parallel Implants tool, then go back and deselect the option. After that option is turned off, you will then be able to place other implants that are not parallel, but the ones that were set to be parallel initially will remain so. Another useful tool is the option Lock to Implant. This locks the restoration to the implant so that whenever the implant is moved, the restoration will move with it as well. Another useful tool in the software is the Treatment Lock option in the toolbar. When the treatment lock is on, that means you will not be able to add more implants or make changes to the existing implants in the plan. This is helpful when you want to navigate in the rendering window without the risk of accidentally modifying your plan.